19-year-old gram stain is being shown in the figure, and he comes with urethral discharge which is of about 1 week after having a night stop unprotected impulsive sex. And what do you see on the slide? Gram negative diplococci, which are gonococci, is what you have to remember. And the patient is treated with ceftriaxone, and 5 days later, due to persistence of discharge, he once more comes back. So what is the other organism in addition to gonococcus which is known to lead to urethral discharge? Very commonly chlamydia. So there is a reason you should suspect chlamydia as the responsible organism. 32-year-old was prescribed oral antibiotic for a urinary tract infection. Hemoglobin was 85, peripheral smear is being shown. What do you see on peripheral smear? Bite cells are what you are seeing, which are suggestive of hemolysis. So it is a case of autoimmune hemolytic anemia. Then a 45-year-old with type 1 diabetes has various gastrointestinal complications. ECG was done. What do you see on ECG? ECG will only show in if you go for DNB, CET, All India, APPG or any exam, either infarctions, arrhythmias or electrolyte disturbances or things like WPW syndrome, etc. Totally there are 20 ECGs. Most of the times they are only repeated. So what do you see here? Look at the QT interval. Typically the QT interval, the beginning of the Q to the end of the T, if it is more than 400 milliseconds, right, 400 milliseconds, then you call it as a prolonged QT. Normally it is 400, more than 600 milliseconds you call it as prolonged QT. So this is a case of long QT syndrome, and long QT syndrome is caused by drugs like erythromycin. There is a list of drugs which lead to the development of long QT syndrome is what you have to basically remember. We welcome Surya Prabha, Annu, the students of Guntur and many more who are online. Online it started on time, yeah, you uploaded online on time, right? Gandhi students, are they online? Please check. Ask the Gandhi Medical College students to punch. 32-year-old with chronic renal dysfunction, and his imaging is shown in the figure. So what do you find? Polycystic kidney disease. So what is the antihypertensive of choice in a patient of polycystic kidney disease so that you can decrease the progression of the renal deterioration is a very important question. So very happy to see Tirupati students. Yeah. So what is the answer, Dr. ACE inhibitor is the best drug. 42-year-old has dysentery, undergone endoscopy, and what do you see on endoscopy? Ulcerative colitis is being found, and anti-smooth muscle antibodies are positive in that person. So anybody who has an inflammatory bowel disease in whom serologically you found anti-smooth antibodies, what is the diagnosis that comes to your mind? Autoimmune hepatitis is what you need to suspect. It is one of the important serological markers. That's the reason you need to do liver function test in order to look for the possibility of a autoimmune hepatitis is what I want to underscore. So you will have elevated AST, ALT, bilirubin, alkaline phosphatase along with anti-smooth antibodies in an inflammatory bowel disease patient. That is autoimmune hepatitis. Once more, in autoimmune hepatitis you have got type 1, type 2. जरा एक बार देखना, what is the difference between type 1 and type 2, etc., etc. 49-year-old has an erectile dysfunction. He is taking amlodipine, and he admits that he works long hours entertaining the clients. His BP is 145/82, BMI is 31, and investigations were given to you, and his physical examination is being shown. So what do you see in the physical examination? Classically, bilateral gynecomastia along with erectile dysfunction, along with elevated liver enzymes, suggestive of alcoholic liver disease, chronic alcoholism is what you need to remember. 34-year-old is having palpitations and ECG was done. You see between P wave and QRS, the distance is very narrowed, PR interval is shortened, and when the QRS is throwing upstroke, there is a slurring which is there. So what is that entity? Typically it is an example of WPW syndrome is what you have to basically remember. And what is the treatment? Radio frequency ablation is considered to be the treatment of choice. 35-year-old with weight gain, history of amenorrhea, and she had been trying to conceive, and physical examination is showing Cushingoid appearance, and you are suspecting that Cushing's is the possible underlying cause of her infertility, inability to conceive. So how will you prove your clinical suspicion of Cushing's? What is the first investigation you will do? So basically 24-hour urinary free cortisol levels is the first thing you should do. How many of you answered dexamethasone suppression test? Raise the hand. I know you are our favorite students now. So yeah, when will you do suppression test? After you have proven it is Cushing, you want to know whether the cause of the hypercortisolism is adrenal, pituitary or ectopic. Is the adrenal is working autonomously and producing hypercortisolism? You want to know. Then the dexamethasone suppression test is a differentiator is what you need to remember. 35-year-old with left-sided weakness. She has a young family with a 5-year-old son, 2-year-old daughter. Previously she had 2 spontaneous abortion, and she developed DVT. And what did she develop? Middle cerebral artery stroke. So abortions, middle cerebral artery stroke with thrombocytopenia with the DVT puts her into the antiphospholipid antibody syndrome is what you have to basically suspect. Then doctor, what do you find in the sclera? Classically it is a question of case of scleritis. Scleritis. Did they give you that internet link on News for Medico so that you can browse through the clinical images, which can never come so clearly on a printer? Anyway, all entrances are nowadays online, right? So scleritis. So which condition is associated with scleritis? Episcleritis, rheumatoid arthritis is the typical entity.